Коллеги, я вас всех приветствую. Мы снова отправляемся в Балканские страны. На этот раз мы сначала заедем в Северную Македонию, далее Косово и потом Албания, где встретимся с Клейдой Тани, инструктором по динамической нейромышечной стабилизации. Поехали! Hi, Kleyda.
Hi.
So I'm happy to be here in Tirana.
I'm glad you are here in Tirana. It was a very nice surprise.
Okay, and I hope that we'll have a short interview with you.
Yes.
So I have like three easy questions.
Mm-hmm.
The first one is, can you please tell me, and for my subscribers, a bit more about yourself?
My name is Kleydy Tani. I'm Doctor of Physical Therapy. I have done my studies in Czech Republic, in Prague, Charles University of Prague, my bachelor and my master degree in physical therapy, and I have done my studies of doctoral degree in the University of Medicine Tirana. I have practical experience from 2010 till now, so 23 years, 13 years, 13 years of physical training experience, practical, and also from 2012 and till now, I have been a lecturer in the University of Physiotherapy in Tirana. I have two clinics, one in Tirana, and we are 7 physical therapists that we work in the two clinics. We mostly do manual therapy and DNS practice in our DNS postural exercise practice in our clinic with our patients.
Can you please tell us more about your patients and about the problems what they have?
Most of the times our patients are middle-aged or young age, I would say 20 and more. We don't have a lot of children. Most of them have disc herniation, cervical spine problems, lumbar spine problems, coxarthrosis, knee pain, impingement syndrome, so mostly osteomuscular patients. These are the typical patients that we treat in our clinic. And they have chronic pain because in Albania they are not used to go to the physical therapy very quickly, so they come to us after a year or months of pain. And so we mostly treat them with manual therapy and DNS exercises from the DNS principle, dynamic neuromuscular stabilization principle. And we see very good results. We don't use any ultrasound or modalities. We don't have any of these machines in our practical clinics. And we just use our hands and our mind with our patients.
Okay, so manual therapy and DNS exercises.
Yes.
Can you please tell us more about the DNS?
The DNS, dynamic neuromuscular stabilization method, it's a kinesiological approach principle that was invented by Pavel Kolarz in Czech Republic. He was inspired from Vojta method, from Karel Levitt principles and Mojžíšova, and he applied the kinesio. It is mostly applied from the ontogenesis of the babies. So if you see the DNS exercises, they are a combination of postural static exercises and static stayings of the positions of the baby from 0 to 1 year old. So like squats, maybe tripod or quadrupedal positions. And the principles are how to use because in the first year of our development, every movement is in our subcortical part of the mind, so it's programmed. We don't think about it, we just do it. So all the muscles that are activated in the first year are programmed in our mind. So in a way, when we use these exercises in an adult age, these muscles have the memory to reactivate in the right direction. So how the diaphragm should be, how the muscles should be in a centrated position, so that a joint can be in a centrated position, and we can have a synergy of the muscles. So this is the basic principle. So we take the movements and the postural positions of the baby till the fourth trimester, so the first year, and we apply these positions to adults depending on their problem. And depending if it will be like quadrupedal or bipedal or different positions, with the idea and our goal is to activate the muscles and the joints in the ideal position, how they were programmed in the first year of our age. So when we do this and we teach the patient how to do it also by themselves, so they change the program of their mind when they are in adults, so the muscles can reactivate in the right position and in the right activation in the right way, so they will not have any pain in the end of the treatment.
Do you correctly understand that there is the DNS for the kids and there is a DNS for the adult people? So, do the physiotherapist who is visiting the courses for the pediatrics, DNS pediatrics, can use it for the adults? And do the physiotherapist who is visiting the course for the adults can use these technologies for the kids, or they are different?
The principles are the same. The idea is the difference between there are two. The course has the same principles, so the principle of DNS is the same. The difference is when you do a DNS pediatric course and a DNS adult course, is the fact that when you do a DNS pediatric course, you have to really concentrate in the examination of the babies and of the children, and to really understand in every trimester and in every month what the baby is capable of doing and how the muscles and the movements are done in the right way for their age appropriate. And also you will be taught some exercises for babies and for children. When you do the adult training, we don't really concentrate in every detail of the examination of the babies. We explain mostly how the ontogenesis of the babies is, how every month the muscles are activated. But we mostly do it so you understand the principles and the activation of the muscle and the centration of the joint, and how you can apply that type of activation and that type of ideal positioning in the adulthood. But we are not so much concentrated in the examination and what the test is and reflexes of the babies are. So if you are a physical therapist that you work mostly with the babies, I will suggest mostly to do the DNS pediatric course. But if you are a physical therapist that you use the DNS method for adults, or you work mostly with the adults or teenagers, I would strongly suggest to do the DNS Basic A and B course. So depending on your practical training.
Okay. Kleyda, thank you that you invited us here to Tirana. It was nice to meet you.
Thank you very much for coming.
And we actually are hoping to see you in Moscow with the DNS courses.
Yeah, for sure. I will be there. Thank you.
Thank you.